No matter your age, your plan for retirement can start today. From the News Channel 5 Network, this is the Retirement Report.
Good morning. Welcome to the Retirement Report. I'm Hank Parrott, your host. We're going to be talking again. We're going to pick up where we had left off on our last two weeks talking about Medicare. Before, though, I want to jump in real quick about all the volatility in the stock market, what that might look like for you going forward. We've had a lot of bumps, if you will, when we're looking year to date. In fact, I'll share some numbers with you. When you're looking year to date, the S&P is down almost 25% year to date. The Dow Jones almost 20%. The Russell 2000, your small caps are down 25%. NASDAQ down over 33%. And even when you look at international and emerging markets, in the indexes there, the EFA, for instance, down about 27%. So we're seeing, we're still in this bear market territory. Now, we've had a day or two of, bumps of increases. We just got the news on the inflation number, and at first the market reacted very negatively and ended up in a positive. So we'll see how Friday ends for the week here in October. But when we're looking at the markets, the biggest thing I would say is watch out for these what are basically like a rally, bear market rally, meaning that it's probably not going to last. It's more likely that it will revert, and I'm not sure that we've hit bottom, basically. So this is something to keep in mind when you're staying disciplined is the key. So however you're invested, making sure this is a good time to review and be sure that you're properly diversified, that you've got the proper asset allocation models, that you're well positioned for when the market does go up and get into our next bull cycle, that you're going to be properly positioned for that, and making sure that just when the market's down as much as it is, and I'm sharing these index numbers with you, keeping in mind there are mutual funds out there that are not doing that well, that are doing even worse. There are other, even bonds. The AGG, the Barclays aggregate bond index is down 15% year to date. Very unusual to have stocks and bonds both take a bottom like this. In fact, this is the first time in 50 years, the first year in 50 years that the AGG, the bond index, has underperformed cash. So normally we get a positive return from that most years. So this is going to be one of those unusual years, to say the least. And it kind of is reminiscent in that area back in the financial crisis, when we see every index take a hit, when we saw the market and across many sectors, not just here in the U.S., but internationally as well, we're down. And this is kind of the same type of thing, not as necessarily severe yet, and hopefully it won't be, but still something to watch for. So again, going forward, the biggest thing, good time to do a review of your asset allocation models, make sure that you're properly diversified, and by that I mean you've got hundreds, if not ideally thousands, of holdings within your portfolio, okay, of different companies. That's the safest way. So if there are companies that don't make it, if there are companies that don't rebound when the market goes back up, you're going to have enough other companies that that's not going to be a concern, and that you're going to at least get, as the market as a whole goes, you're going to benefit from that. And at the same time, keep in mind of your asset allocation too, how much you have percentage stocks to bonds, that ratio, because that's the other part that speaks to it. The higher the stock ratio, or the percentage of stocks in your portfolio, of course, the more volatility, the more risk, but over the long term, the higher reward as well. It's just being comfortable with the risk you're taking on. If the market continues to go down and we see a 30, 40, 50% drop, are you comfortable, all right? Are you going to be, you're positioned well to where you can say, I can ride that out, it's okay, I know it's coming back, because the market does always go up over time. Even in the short term, we have bear markets and corrections. In fact, we use bear markets about once every 10 years. You'll see even drops of, I think it's about 1 every 6 years of 20% or more, and then you'll see drops of 10%. That can happen almost annually. So that kind of volatility volatility. If you're going to be invested in the market, you have to accept. And it's just finding out if you want to reduce down that volatility, you reduce down the amount of stocks in your portfolio. If you're not, so for instance, if you're very aggressive at 85 and this is making you very uncomfortable, you might want to think of maybe reducing that down to 75 or even 60. If you need some help with that, just call my office. The number is 615-376-5325. If you'd like to get a comprehensive financial plan, it includes taking an analysis of your current portfolio, seeing how you're positioned currently for going forward, making sure, for instance, sharing some safe money ways that you can blend in with what you're currently doing. Talked about fixed index annuities a number of times on the show. This is a great way that you can replace some of the bonds in your portfolio, and in particular when you see the bond market down 15% this year, year to date, this is one of those areas you might think, maybe having fixed index annuities where I wouldn't take those kind of drops could be a good thing. So you don't, with a fixed index annuity, your principal's protected, and you're going to get a return tied to different indices in the market. So it's a good way. Again, there's a lot of research pieces on that. If you'd like to get a copy of either Roger Ibbotson's report, his research, or on Barclays FIA fixed index annuity report, both show basically how fixed index annuities outperform bonds over the long term. If you'd like to get copies of those, just ask when you call my office, just ask for that as well, and we'll send those to you. All right, again, 615-376-5325. If you'd like to get a comprehensive plan, financial plan at no cost, call the office. We'll get your information, send you out a checklist of things to bring to your appointment with me. And when you come in to see me, I will also give you a free copy of my book, 7 Steps to Financial Freedom in Retirement. And basically what we're going to do, by the way, is we're going to look at your income, your expenses, your assets, your liabilities, factor in for inflation, for taxes, rates of return on your money. All of this we can show you with the reports I'll run for you. I can show you your financial future based on what you're currently doing, and then share strategies to help improve that future. Okay. When it comes to the markets, again, this is an area where staying disciplined is the key, okay? But it's also a good idea to make sure that you're properly positioned in the market. So it's worth taking a look at, and that includes on your 401ks, by the way. All right. One thing, by the way, I should also point out, there was a great article in Market Watch. The S&P 500 sees its third leg down of more than 10% this year, and it was talking about what history shows about past bear markets. Basically, what it means is usually you've got the market dropped, and then we had a bear market rally, and then it dropped again, and then we had another bear market rally, and then it dropped again. Normally, or historically, that would mean that we're likely to continue down until we hit a bottom. Now, the occasional day like yesterday where we might see the markets, get a big bump, I would again caution not to think that, everything's fine. By the same token, this isn't a time to just sit out on the sidelines, because we don't know. You miss a big day like that when you're trying to time the market. So market timing's not the answer either. The key is finding the right plan that's going to work for you. We've talked about a number of different ways you can protect yourself. Virtue Capital's been on a number of times talking about the stop loss strategy as an example. All good things worth looking at a time like this. Like I said, just kind of reassess, and then once you've done that and you're, yep, I'm properly positioned, I've got everything I need in good order, then it's just, we're going to stay disciplined, we're going to ride this out, and we know that in time, okay, whether that's a year from now, 2, 3 years, whatever it is, we're going to be back in the positive. Okay, we're going to get into the Medicare thing again. I talked about, I'm going to do a quick recap for you just to bring you back from up to date from what we had done over the last 2 weeks. We talked about Medicare, who's eligible, when you're eligible, what dates based on your birthday and that. The 2 options for Medicare we covered, which basically original Medicare, where you have Part A, hospitalization, Part B, outpatient, Part D is your prescription coverage, and then Medicare supplement is typically needed to cover all the deductibles and co-pays that are not covered by Medicare. And then you have Medicare Advantage plans, which is also Medicare Part C. And on Medicare Advantage plans, this is where you have more, everything's all inclusive. So you're going to get more coverage, typically for less cost, but the one catch is you've got to PPO. You've got a preferred provider organization, so you're a little more limited on who you can see. So you want to make sure you're matching up the right plan, Medicare Advantage plan, with the making sure the doctors you see are accepted in there. And basically, when you plug in, if you went to Medicare.gov, for instance, and you plug in your information, they'll give you some plans to choose from, and you can they'll help basically filter through some of that. But even better, we've got today Warren Cranford joining us. Warren is a benefit specialist with Medicare, or I shouldn't say with Medicare, but for Medicare Advantage, but basically Medicare Advantage plans as well as Medicare supplement plans. So Warren, this is one of those areas, and I'm not, we covered already the Part A, the Part B, but there's been some changes. So why don't you talk about those before we get into talking about supplement policies and Medicare Advantage plans? There's been change. We just got news about the new increase now for next year, and I guess there's some other news that's come out with that.
Yeah, with next year in 2023, we're looking at some changes with the Part B deductible and premium next year, as well as some changes within Part A, the hospitalization, a part of the original Medicare. Some increases in costs there as far as the hospitalization goes. But I think one of the main things to share today that the audience may be interested in is the Part B premium next year is going to go down. This year it's $170.10. And next year it's going to go down to $164.90.
That really did surprise me. I just thought, why? We know that Medicare, Social Security, they've got to do some fixes for because of the financial condition that it's in. But even more with Medicare. Medicare is underwater more than Social Security, and yet they're reducing it. Cynical person, I think, might say something about politics. Was that what it?
Maybe so, maybe so. So they do, from time to time, of course, it is a surprise to me as well that this year, that next year's Part B premium will be reduced. That's not typically the norm, but it is happening for next year, which we'll take what we can get, I guess, and whatever little bit will help. Also, the Part B deductible, which typically for those folks that understand and know that they utilize original Medicare and they have a supplement or Medigap policy in place, will understand the Part B deductible. This year it's $233, and next year it is going to go down to $226. So those two things are happening in the Part B arena as well. But again, Part A, the deductible or copay that you pay for an inpatient admission for one day, this year it's $1,556. Next year that is going up to $1,600, as well as some of the other daily pays or copays you'd pay once you reach day 61 and day 91. There are increases in those amounts for next year.
Well, and most people are going to have a Medicare supplement policy. We're going to get into those in a moment. So if I'm reading that, then if they're going to increase these costs, we're not necessarily, most people that are on original Medicare are going to have a Medicare supplement policy. Correct. So the insurance is going to have to cover it. That would seem to indicate that insurance premiums could well go up for your Medicare supplement plans.
Yeah, well, and with Medicare supplement plans and stuff, those Medigap policies or supplemental policies, what we see typically what on the average happens is that there's annual increases. Sometimes there can be increases on an anniversary date, but also just based on a lot of data, statistics, information that these companies, private insurance companies, utilize. There can be other increases, additional increases at different times during the year as well.
I mean, inflation itself.
Anticipation is that it's probably it could have some effect. So
this is one of the areas. I mean, inflation itself is such that we know medical costs go up faster than the CPI numbers do. That's one of the areas that typically accelerates quite a bit past that. So when you have that medical costs already increasing and Medicare supplements, of course, or you're buying insurance to cover those increasing costs, it's natural to expect that premiums will go up, especially when we see that even pass through now on the national level with the Medicare now saying that we're going to have higher deductibles and copays as a part of the coverage, meaning they're going to cover less and these companies are going to have to cover more. They're kind of shifting some of that cost over, and of course we know that's going to come back to the consumer, because the companies that we're buying this insurance from, they're companies there to make a profit. So they have to cover their costs. If their costs go up, your premium's going to have to go up to help cover that cost. Something to be aware of and be cautious of going forward. Be thinking, and again, with healthcare costs in general, in retirement, this is what we're going to be, this is why it's so important to understand this. You're talking potentially hundreds of thousands of dollars over your lifetime. From someone age 65, to put that over the next 20 years, you're likely talking hundreds of thousands of dollars out of pocket, right? So it's a good idea to understand how these work and how you can maximize the benefit and help reduce that cost for yourself. All right, quick break. Join us here. We'll be right back on the Retirement Report.